So, Doctor, what do we do as Americans come back out? How do Americans, how do governors, how does this White House, how do we all thread the needle to reopen parts of our economy without causing a deadly second wave even this summer?
So I think the first thing that we should be doing is remembering that as individuals, we have important roles to play. We need to continue to have our own space, physical distance for people that are outside your family. We should be wearing cloth masks in public. We shouldn't be going to large gatherings at this point. We should be telecommuting. Independent of reopening, those things should continue as the baseline. That should be our new normal for the time being. Unfortunately, that's what we need to do. And I'm worried about some leaders' communication about that hasn't been completely clear. So we should be very clear about that. Those kinds of things need to keep going even as we begin to reopen in various places around the country. And in the reopening process, I think, yep.
Oh, I'm sorry. I was just going to say, you have correctly pointed out that some of the large outbreaks have been in larger institutions, whether you're talking about nursing homes or prisons or factories. How do we manage those areas and the larger institutions that have caused such a high degree of outbreak and death in this country?
So in particular, we need to do a number of things. We need to make sure that the people working there, or in the case of prisoners or nursing home patients, that they're very well protected with personal protective equipment and masks. We need to make sure that the operations within those institutions are trying to keep space between people, less direct touching between people. That's how the virus moves. It moves between close interaction. And so wearing masks, decreasing touches between people in those institutions will help. And then we need to have a very low threshold for testing in those places, early testing to get really early signs of any outbreak and be able to step in and isolate people and quarantine their contacts. That's going to be really important until we have a vaccine.
So, Doctor, I'm going to hope that your Skype holds out for one more answer, because I've read in places. Sure. I want to get your reaction to this. I've read that this pandemic spreads in huge clusters, and others have suggested that simply going to the store, getting groceries, coming home, getting takeout, those sort of activities have not yet proven to be deadly, have not proven to be accelerators of this pandemic. Do you have any scientific evidence that that is the case?
There have been some studies which have really tried to understand with a lot of precision where people were most likely to be infected. And we do see that the evidence is highest for infection within one's home when someone gets infected, other people are at high risk, within close indoor spaces, so workspaces, and or other gatherings. We've seen clear evidence of people getting infected at dinner parties, birthday parties, funerals. So even small gatherings, there's less evidence for people getting infected with just glancing interactions that they might have walking down the aisle of a store or something else or some other place. But to diminish that risk even further, people should be wearing masks, cloth masks, so that they don't infect others. That's the key with masks.
Director of the Johns Hopkins Center for Health Security, Dr. Tom Inglesby, thank you very much. We hope to have you back on the show. And coming up, our next guest says Donald Trump's rise is often told as a hostile takeover. But in truth, it's something closer to a joint venture with America's most prosperous citizens. We'll talk about how so-called Greenwich Republicans learned to love Trump and what it could mean for the next election. That's next on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.